and welcome to Study Topics. This week we're going to be covering practice vignette style questions. Now remember, this isn't our first video where we've gone over vignette style questions, so make sure to go back and check out some of our past ones. Okay, let's get started. So how this is going to work is I'm going to give you approximately a minute to go through the questions. Remember, we suggest a minute and 10 seconds for vignette questions and 45 seconds for standalone questions. So I'm going to meet it kind of right in the middle for this one. And let's begin. Alrighty, let's review this question. So the vignette is saying that your 65-year-old patient suffered a stroke 9 months ago. He's actively participating in a weekly outpatient program, but despite his efforts, he still has vision issues. He was also recently diagnosed with right-sided heart failure. So what type of vision loss would occur with a lesion at the optic chiasm? Let's review the answers. If we look at bitemporal hemianopsia, which again, these are just these answers brought over, we know that a lesion at the optic chiasm would cause bitemporal hemianopsia, or we also call this tunnel vision. So this is a type of partial blindness where the vision is remaining in the outer or those temporal parts of the right and left visual field. So if you take your eyes, the inside is called the nasal field and the outside is called the temporal field. So if you've lost the temporal field, you will only have tunnel vision. So that is why A is the correct answer. I'm going to give you a second to review B, C, and D. Now remember, if you didn't get this question right, there's lots of great resources out there. If you're in our course, make sure you look at the optic lesions. That's going to really make this clear to you. But let's move forward. Here's the next question. All right, let's go through this again. So I've brought all of these answers over onto the other slide. So let's review the correct answer. Here's the thing we want to think about in this question. We want to know which of the following signs and symptoms is not associated with both left and right heart failure. So remember the difference between right versus left and when we have more lung involvement. So we are looking for something that's not associated with both. And we know that pink frothy sputum is a hallmark of left heart failure, not right heart failure. And that's because it's due to pulmonary edema that occurs only with left heart failure. If we look at kidney and brain issues due to decreased perfusion, we know this can be found in both left and right. Shortness of breath also can be found in both left and right, and lethargy definitely can be found in both left and right. Okay, one more question. So same vignette. This time we're looking at a little bit more closely into head injuries. So I'll give you a few minutes to think about this, or a few seconds. Alrighty, so this one comes down to your cranial anatomy. So what we're looking for here is we want to know which structure is in close proximity to the optic chiasm. If we look here, we know the frontal lobe, the optic chiasm doesn't lie in the frontal lobe. It's part of the cerebral cortex. So what's the primary role of the frontal lobe? Well, it does speech, cognition, and movement. Versus in the brainstem, we know this does not lie in close proximity to the optic chiasm as the hypothalamus. So when we look at where this is located, it's at the base of the brain and contains the midbrain, pons, and medulla oblongata. For the primary role of the brainstem, we're looking at a control of messages between the brain and the rest of the body. It also is that basic control of those basic functions such as breathing, swallowing, heart rate, BP, consciousness, and whether one is awake or sleeping. If we look into C, we know that C is the occipital lobe, and it does not lie in close proximity to the optic chiasm, which is, again, part of the cerebral cortex for the occipital lobe. So what is the primary role of the occipital lobe? You should know this, vision. So last, D, which is the correct answer. The hypothalamus is in close proximity to the optic chiasm. The optic chiasm is located at the bottom of the brain, immediately inferior to the hypothalamus. You may be asking, what's the primary role of the hypothalamus? Well, it keeps the body in homeostasis through regulation of hormones. So if any of these areas of the brain you are unsure of or unsure of their main function, make sure you look it up. But that's all I have for you for this week for study topics. And make sure, again, you go look back at part 1, 2, and 3 for more practice vignette style questions. Happy studying.